Let's start with actually go right to it and get to probably the most divisive issue, which is reproductive care and health care, reproductive care and abortion rights and women's issues. Tell me where the bipartisan light is on that.
Yeah, it's hard. There's not a lot of light, and Vice President Harris wants to ensure if she's elected, she wants to codify Roe versus Wade through Congress. It's going to be hard to do, but that is her focus. President Trump wants to, he's not talking about a national ban anymore, but he certainly seems fine letting the states. Go at it. And over 40 states have some restrictions on abortion. At least over a dozen have severe restrictions. Um, and so that is absolutely a big divide there. There are also some questions related to what the executive branch could do under a Trump versus Harris administration. There are other ways to restrict access to reproductive health services, such as abortion. Um, look at mifepristone, which is the most common medication used for medication abortions, which are about 2/3 of abortions in this country. FDA could change their stances on that. There are issues related to Title X family planning clinics, and then finally, Jeremy, from a state perspective, just for a moment, there are 10 states where abortion, reproductive health services are on the ballot, including swing states like Arizona and Nevada. Since the Dobbs decision overturning Roe versus Wade, 7 states have had referendums. All 7 have enshrined reproductive health choices, abortion, in their constitution. So 7 out of 7. We'll see how these other 10 states do on Tuesday.
In terms of one area which I would think would be bipartisan, but I'm not sure it is, relates to this, which is Mtala. That's the Emergency Medicine Treatment and Stabilization Act, 1984 Reagan administration kind of era law that says that hospitals, have to take everybody, and we have to see. I'm an ER doctor. We have to see everybody and stabilize them, life and limb and pain. But Mtala sort of has entered the conversation because it's a place where some of these issues kind of come into conflict with one another, right? So you have somebody whose life may be in danger, but you don't know if it's today or tomorrow, and abortion might be definitive care to keep them safe. EMTALA is a law that both sides support. Is that correct?
It is. It is. It's a federal law, and it's been in the news lately because of a Montana case that made it up to the Supreme Court. And the issue here, does EMTALA, as a federal law, trump state laws regarding restrictions on abortion care? And so this is playing out, Jeremy, in states across the country. And I think, exactly as you said, as physicians and clinicians, we have been trained, as well as morally, we believe we need to do everything that we can to take care of the patients in front of us and to save lives. And so this is playing out in states across the country, tremendous legal ramifications, and I suspect the courts will continue to take a look at this, and maybe it might go back to the Supreme Court. So we're just going to have to wait and see. Traditionally, this should absolutely, you're right, be a bipartisan issue.
One more thing about this issue before we maybe pivot to another direction, which is what you said a moment ago about Vice President Harris's sort of view and agenda on this. She said that she wants to codify Roe into law, and you aptly said, good luck, because that requires legislation in a very, very polarized world. Not only polarized, just there's just different views on this, and the Supreme Court has basically made it fair play to talk about. So she's running on that, but what can she really do, right? She can't do that. I'm almost certain she can't. And if
Yeah,
she can,
yeah.
she'll sign it. But what can she do if she's president to sort of push back against some of the post-Dobbs efforts that have been against what that side wants?
Yeah, yeah. Very difficult to do anything in Congress. Um, States will likely continue leading on this, and um, that's unfortunately somewhat chaotic. The legal system will continue to be involved, but as I said, I think the executive branch, regardless of who wins, will have influence as to, again, access of mifepristone is one example at FDA. Funding of Title X family planning clinics is another example. So I think there are executive branch actions that can support choice or further restrict choice. And I think that's where you'll see the differentiation between administrations.
Okay. And do you think that the Supreme Court is likely to decide these cases on the merits or on the politics?
Jeremy, that's it's that probably depends on your opinion of the Supreme Court. I think we all want it on the legal merits and want to give the benefit of the doubt to the Supreme Court. Um, I think we've seen the politicization of this issue, like many other healthcare and public health issues, increase. And so I think we're just going to have to wait and see.
Okay.
Yeah.
All right, let's talk about healthcare reform and really access to care and affordability. It's interesting to me that the Affordable Care Act is now no longer called Obamacare. People like it now, so they call it the Affordable Care Act. I think that's a quip that maybe the former president himself made. Um, and there are certain things that are very popular. Nobody really wants to threaten this idea of taking away coverage for people with pre-existing conditions. But it seems to be in the last Trump administration, they certainly did try. Um, Famously or infamously, former President Trump said, "I've got concepts of a plan." Do you have any idea what he would do on this issue, on ACA and access in general, were he to be reelected?
Yeah. Very difficult to you know to predict there. I think you'd have to go back to his first term to see what he did. He certainly didn't support marketing and outreach of the current ACA exchanges. I think his administration looked to try to increase choice and tried to make what are called short-term plans or association plans, um, up to 12 months become more prevalent in that, but those plans don't necessarily have to cover pre-existing conditions, for example. So they're not as
Like,
robust.
can you say
So
more about that? Can you say
yeah,
more about that? Because I don't think that people really, including myself, really know that nook and also why it can actually not cover pre-existing conditions.
yeah. Well, the ACA did allow what are called these short-term plans, association health plans for individuals. Let's say they're changing jobs or having different life circumstances up to 3 months. You could be in these plans, likely cheaper plans, but much more robust. So these plans don't have to meet what are called the essential health benefits that ACA plans do. Many of them don't have to cover pre-existing conditions. And what Trump administration did is extend from 3 months to 12 months. So you could be on these plans for longer. Uh, Certainly in their minds to increase choice, to provide some cheaper options out there. But in many cases, these are some would consider them junk plans,
Mm.
but certainly less robust plans. And so that's the rub there. How do you ensure choice? How do you ensure affordability? While at the same time ensuring that these benefits are robust. If people have health insurance, they want to make sure it means something. So if they need care, they can get it. But it really is unclear exactly what they would do. Now, 21 million Americans, Jeremy, are on these healthcare exchanges, and that's a record. When President Biden started 4 years ago, it was about 10 million. So it's gone up to 21 million now. President Trump's former advisors claim that there's a lot of fraud in the program. There are a lot of people not correctly providing their income. They're getting too many subsidies.
Hmm.
The big political fight next year, regardless of what happens November 5th, is should the advanced premium tax credits that are supporting millions of Americans that remain on these exchanges so they have affordable premiums, should those be extended? And Democrats are probably going to be for extension of those advanced premium tax credits. Republicans, the Republican administration is probably going to be against it. And that would, if they're not extended, that would lead to several million more Americans uninsured. So I think that is on the Obamacare ACA exchanges. I think that is going to be the big political fight.
It's interesting to me, obviously, just very like broadly speaking, the Democrats are a little bit less shy about expanding a program or spending, and supposedly Republicans are the opposite. It never really works out like that. But how often have the Republicans actually followed through on something like that and said, "Here's a benefit that you have. We don't like it. We're taking it away." because it seems like it's more like it's easier, as they say, it's easier, it's harder to take the yoke off. It's easier to never have put it on. Once these things are in place, do the Republicans really have the appetite to say to people, "Oh, here's a tax credit you have. We're taking it away because we're trying to save some money."
Yeah, no, you're exactly right. Once people have a benefit, very difficult to take it away. And I suspect, Jeremy, this is going to be part of a much broader deal-making process in Congress next year. Um, so the big elephant in the room, again, regardless of what happens in 4 days next year, will be that Congress will have to discuss how to extend $5 trillion in tax cuts if you combine both the 2017 Tax Cuts and Jobs Act and the 2022 Inflation Reduction Act. That's $5 trillion, and this is everything from, most of these things are things that Republicans will support, but many of these things are things that Democrats will support, like the child tax credit, like the advanced premium tax credit extension. So at least a couple trillion Democrats will support. The big issue will be how much can you spend, and then what are the offsets to cover that? Just the advanced premium tax credit piece, which we're focused on in this conversation, that's $335 billion over 10 years. So just that has a price tag. So thinking through the offsets and the potential deal making, I suspect you're right. There are going to be some Republicans who are going to say, you know what, we can't afford to take that away because that's already a benefit there, but it's got to be paid for. And so this will be part of a much broader discussion on tax policy, which will dominate public policy in Washington, D.C. in 2025.
I'd like to ask you a question and have you answer it twice, which is that really about the Affordable Care Act and its provisions. And the twice is where is public sentiment on the ACA right now? And the second answer is how do you think that contrasts with how physicians and healthcare professionals feel about it?
Yeah, I think the ACA is baked in to the system now. Critical for healthcare professionals, healthcare systems. I think for the public, I'm not sure how much they talk about it. Again, 21 million people are getting their coverage from these exchanges. Millions of more have now been able to get on Medicaid through Medicaid expansion in 41 states. So I'm not sure. I really think that it's now baked in, and therefore you see, and you alluded to it as well. You're not hearing the repeal and replace cries. You're not hearing the occasionally you hear somebody saying on the Republican side, let's do away with the ACA, but there are no big broad ideas to replace the ACA. So I think politically, as well as from a healthcare perspective, as well as from a public and patient perspective, I think the ACA is here. It's a question of how do you either strengthen it in the case of Democrats and a potential Vice President Harris presidency, or how do you modify it in different ways that might not strengthen the program. And I think you'll probably, that'll be the debate in, I think, a Trump administration.
I'm thinking back to 15 years ago when ACA was being debated. I'm sure you remember it well. And I just remember that people on the Republican side were kicking and screaming, and even after it got rolled out, and saying things like, this is going to ruin healthcare, it's going to sink our economy, and it's going to cause all kinds of problems. And my question is, were they just wrong, or were their criticisms actually really valid, and that there are things today that were sort of, as you say, are baked in that we accept, and they may not be ideal, or we haven't yet reached the point of reckoning where it will sink our economy in some kind of way?
Well, I'm sure that there are still some criticisms, and people will talk to Affordable Care Act. How much are things really affordable on the exchanges? And I think people will criticize some of the Medicaid expansion and all. But if you look at the objective data, it's hard to argue with the fact that the ACA has done tremendously positive things. I mean, we were at an insured rate in this country of about 83 or 84%. We're up to about 92% right now. So tens of millions of Americans having access to health insurance. Why is that important? You have millions of Americans now receiving clinical preventive services without any cost sharing, which we know is very important. We've seen disparities in care reduce as well. And so by a number of different sort of objective measures, certainly affordability in healthcare is a challenge, and that's going to, because of prices in this country, that's going to be a problem. But I think there's been a lot of progress, and I think the other area, of course, is value-based healthcare transformation. ACA sort of injected, and it's still slow. We're still moving from a fee-for-service to a value-based environment, but ACA really injected a push for us to get in that direction. So objectively, hard to argue that the ACA hasn't done some positives. I think no public policy is going to be perfect. So I think there's certainly unintended consequences. There's certainly some affordability issues, and that's why you got to keep working on trying to make things better.
Do you feel like the Republican side has done a lot or a little in terms of this value-based purchasing question? So just to clue everybody else in who might not know all these issues, the government, through Medicare and Medicaid, is reimbursing healthcare providers, hospitals, long-term care facilities, nursing homes, based on the idea, based on are they actually providing good care, as opposed to sort of a, like you say, fee for service. You do this procedure, we'll pay you for it. And this leads up to HHS, where you worked, and CMS, the kind of subsidiary there, having all these really detailed quality metrics and regulations, where regulators are breathing down hospitals' backs. And everyone sort of hates that Joint Commission visit, which really what that is it's essentially a non-government actor looking in on the government's, kind of helping the government decide whether it should pay these hospitals and all that. And I'll tell you, there's bipartisan sentiment on this one. Nobody likes it. And so I wonder, does the Republican side do a lot in this area? Do they come after some of these regulations, or is that not where their focus has been?
I do think there has been, to an extent, a bipartisan embrace of value-based healthcare transformation. If you look at the last couple of administrations, including the Trump administration. But Jeremy, as you know, this is not easy to do, right? When you're talking about a $4.5 trillion healthcare system, where the best studies indicate that probably about 20% of what we spend conservatively doesn't really go to improve health outcomes. Some would call it waste, but one person's waste in the healthcare system is one person's profit. And so trying to work with the healthcare system to extract some of that waste to pay them differently isn't always easy. I think administrations on both sides are trying with all the different sectors, whether it's the health professional sector, the health system and hospital sector, whether it's the pharmaceutical sector. And I think regardless of what happens on November 5th, these are incredibly important sectors who do incredibly important work and contribute to the health of Americans, but really trying to reduce unnecessary costs there. And there's a lot there, right? Think about overuse and administrative costs and lack of care coordination. And then there are all these shiny objects out there from AI and others to say, well, that's going to really save the day. And they may be helpful, but what we need is more of an embrace for value-based models. And I think regardless of who wins November 5th, we need to continue moving down that train.
Yeah, I think the AI thing is, of course, like interesting. We're obviously all fascinated by this. This is one area where I can't decide. I'm curious what you think. Is this going to help the government or not? Because on one hand, anything would help. On the other hand, if anyone's going to mess it up, it could be the government. A great example of this, though, is actually today is November 1st, and which is the day that national reporting for hospital capacity and respiratory viruses, that regulation goes back online. And the American Hospital Association and others actually sort of kicking and screaming, saying this is too much administrative burden. And generally, I'm sympathetic, but I think this one is so important that they should just do it. But they don't feel that way. Could AI help with this kind of thing, with reporting and with decreasing the administrative burden that really drives a lot of the complaining that comes from groups like the American Hospital Association?
Yeah, I mean, I think that's the promise. I think that's what we all hope, and there's increasing literature to suggest that reducing administrative costs. I mean, I think the clinical decision support is to me and to a lot of us clinicians the most exciting. But really, I think in the near term, to the extent that it can reduce burden and we're talking about hundreds of billions of dollars each year in the healthcare system due to administrative costs. If they can help with that, I think that's great. Now, how it comes to fruition will depend on not only sort of the state of science and adoption, but whether policymakers think that some sort of regulatory aperture is important. So I suspect that's going to be also on the on the agenda for the next administration as well.
Let's talk about drug prices. This is an
Yeah.
area where I feel like drug prices are like gas prices. It's like, yeah, it matters. I'm not saying it doesn't matter, but boy, does it take up a more part of our brain than it maybe should mathematically, right? Like gas prices, like it's like not a big part of people's budget, but it's a part that they sort of see every day. And it's not trivial either. So I'm not trying to downplay it, but it just seems like the signal response on these things can be a little bit crazy. The Biden administration, of course, rolled out, I believe, as part of Inflation Reduction Act, that they can negotiate or make rules, cap certain drug prices, and they've gone after a few biggies. Are they do what, 10 a year now? Is this window dressing, or is this really bending the cost curve?
Well, it's real, and it will save costs for the government as well as consumers. How much, I think, in is sort of in relative terms, I think is sort of an open question whether it's enough or not. And I think that's where you see some of the political divide. If Vice President Harris becomes president, she's going to want to accelerate the time frame, the number of drugs. Right now, it's at 10, then 15, 20. I mean, she'll want to accelerate that time frame. She's going to want to do other things as well. Many of the caps that are there, Jeremy, for
Hmm.
insulin, for out-of-pocket costs, she's going to want to extend that to the private sector. It's going to be tough to do. You got to get that through Congress, but she would really double down on many of the things that were done during the Biden administration. Now, President Trump is interesting. He's always railed against high prescription drug
Right.
costs as well, and you'll recall in his first term had that international reference pricing proposal. He also wanted to go after middlemen and the rebate issue.
But
Talked a lot about it.
yeah,
Got
can you?
some things
Yeah, sorry. I
done.
want to hear. I just want to hear about that just for a second because I'm not sure that people
Yeah,
remember that. Can you just
yeah, yeah,
say what those
yeah.
things
So
were?
the international reference pricing issue is essentially wanted to peg the prices for drugs that we pay in the United States to other comparable countries, and essentially the lowest price there, most favored nation, have us pay that same price. And that did not proceed, that reference pricing proposal. He also wanted to really look at the rebates that are provided by pharmacy benefit managers, or to pharmacy benefit managers for placement of drugs on a formulary. He really wanted to look at that system as well. So there are a number of things that he wanted to do. He probably didn't do as much as he actually got done. We know this is an area that he's railed on. What he would do is, I think, an open question, because right now you see uh, what Vice President Harris, I think it's pretty clear what she would want to. She's telegraphed that. It's not entirely clear what a second President Trump term would do in this space, other than continue to rail on the industry.
It's interesting because this particular issue puts two Republican kind of classic Republican values at odds. On one hand, hey, we like to control costs. We don't want to spend more on Medicare. If this is a policy that could ostensibly and just it does decrease costs, the question is it a lot or a little? Versus government getting into the market and essentially taking the market aspect out of it. It's kind of anti-capitalist, which is sort of a strange. Those things are against each other.
Yeah, I mean, I think some would argue that negotiation is part of sort of a market economy and dynamics, and that is what is always done in the private sector. It's what being done here. I think the pharmaceutical sector would argue, hey, it's not true negotiation. That they're ultimately coming up with the,
Yeah,
at the end of the day, the price, and saying, take it or leave it. But yeah, no, I think this is what President Trump brings, right? I mean, these populist ideas that aren't always aligned with traditional conservative thought, and then probably debates within, and I'm sure that happened during his first administration. I'm sure it would happen if he were elected again. these types of debates that you traditionally wouldn't see in Republican quarters, but you would see if he's the president.
Yeah, we've got just a few minutes left. There's a bunch of issues that we're not going to touch, and the bipartisanship of them would be quite suspect. That would be things like gender affirming care, things like maternal health. But I do want to talk about one area where there's both no daylight and also possible daylight, which is gun safety and Second Amendment and related health issues, because obviously this is an area where there's tremendous um, disagreements on how the government should be involved. And yet, there have been times where people have come together from both sides to make some progress. Do you see either way, regardless of what happens on Tuesday, some areas where bipartisan progress on gun safety legislation could proceed in the next year or two?
Yeah, no, great question. Very difficult. My hope is at the very least, Congress can continue funding through CDC and NIH research on gun violence, and so we better understand and shore up the evidence base behind many of these really important interventions, like safe and secure storage, as well as universal background checks and others. But it's going to be very difficult, Jeremy. To find common ground in Congress. And you're right, each administration is going to come in very differently. A Harris administration is going to talk about that, the fact that now this is the number one leading cause of death in children, and we need to be more vigorous. There's a White House office now, and I suspect they'd be even more vigorous in trying to reduce gun violence. And I think the Trump administration, it's unclear if you'd see anything from the White House and what the agencies would do. But again, I hope at the very least we can, for many years, several decades, there's a prohibition or at least an amendment where federal government couldn't even fund gun violence research. Where we at least need to continue the science, and there are important things happening at the local level and the state level there, and continuing to sort of build the momentum. That, look, it's not whether you're for or against the Second Amendment. It's not gun control or not. This is about saving lives, right? This is about saving lives while protecting our rights, and both can be done. And I think the public knows it. Some policymakers realize it. Others are more quiet on the issue. But yeah, no, this is a difficult one in terms of bipartisanship, and one that the BPC, as I said at the outset, there are a few issues, unfortunately. For us to work in an area, I mean, there has to be some daylight where both sides come to the table and say, hey, we want to, we're willing to talk about this. And unfortunately, this is one of a handful of issues we just haven't cracked the nut on how to get folks on both sides of the aisle. But hopefully that'll change.
Last question, I believe. The Bipartisan Policy Center, it's right in the name. You'll work with anybody. If Trump is elected and we get anti-vaxxers in positions of power, how will you and your center, your colleagues, deal with that?
Yeah, I mean, you have to continue speaking truth to power. Vaccinations, as we know, one of the greatest public health achievements of our time in terms of saving lives and saving healthcare costs and increasing life expectancy. And I think that there is bipartisan appreciation, but we can't allow the politicization of, again, traditionally bipartisan issues. And I think, and I think most people on both sides of the aisle get that for vaccinations, but you have to be vigilant there. And I think that, I hope and I suspect that's where BPC will continue to remain.
Well, you will have a very interesting job no matter what. I appreciate the work you're doing and your your valiant attempt to keep the conversation civil, to keep everyone talking. It's the only chance we have to get through these times. Dr. Anand Parekh, thank you so much for joining us here on MedPage today.
Thanks so much. Great to be on with you.
Okay, take care.